Happy New Year! And welcome everyone to the January prevention session in the first VLC of 2022. Very excited. The prevention session today is building or enhancing a coalition to eliminate viral hepatitis part 2. Yay! Made possible in partnership with the CDC's Division of Viral Hepatitis. My name is Isabel Lechuga. My pronouns are she, ella. I am a senior manager here at NASTAD, and I will be your moderator for today's VLC. I am joined today by Sarah Ahmed, Communications and Community Engagement Projects Manager at the NYC Department of Health, Viral Hepatitis Program, and by Tara McKinney, Viral Hepatitis Director at the Bureau of HIV, STD, and Hepatitis with the Missouri Department of Health and Senior Services. We will begin with presentations by Sarah and Tara for the first half of the session and reserve the second half of the hour for discussion Q&A, facilitated by yours truly with Sarah, Tara, and the audience. So please feel free to use the chat box to introduce yourself and your jurisdiction and have questions coming in for the chat box. We will address the questions during the second half of VLC. So that being said, I'm going to turn it over to Sarah. Stop my share.
Hi, everyone. I'm really excited. My name is Sarah Ahmed. As Isabel said, I'm the Communications and Community Engagement Projects Manager with the Viral Hepatitis Program. I am about to share my screen, but forewarning, this presentation is a didactic presentation. So I have questions for y'all. Feel free to raise your hand if you'd like to unmute, chime in, please type in the chat. This is for all of us to explore and learn together. So I'm excited to hear from y'all today during this part of the presentation. I'm going to share my screen. Why is it not sharing? Give me 1 second. It's not sharing my screen. Isabel, can y'all hear me? I'm so sorry.
We can hear you. Yes. Let's see here.
I think it's
all right. What now?
Okay, my Zoom is not working. I'm so sorry, everyone. And we tested it a minute ago.
That's how it works, isn't it? New Year, same problems. Same tech difficulties. Folks can definitely introduce themselves, say hi through the chat.
Give me 1 second.
Of course. We can see it. Looks beautiful.
All right, we're ready to go. I just had to refresh my PowerPoint screen, but we're all set and ready to go. So As I said before, my name is Sarah Ahmed. I'm the Communications and Community Engagement Projects Manager with the Viral Hepatitis Program at the New York City Department of Health. The coalition that we run in New York City is called Hep Free NYC. Our mission is that it's a network building capacity to prevent, manage, and treat hepatitis B and C in New York City. So I wanted to start out with a question for everyone. What is guiding you to and through this work? Why viral hepatitis elimination? Is there specific goals or a framework or a vision that you have for this personally and professionally? What is guiding folks through this work? And I believe folks can unmute if you would like to share in the chat. You have that option as well.
Yes, folks can absolutely unmute.
So to start, I can go first. For me, what guided me to this work is centering the most marginalized in our communities and thinking of inequities and health disparities. And that's what led me to viral hepatitis. So that's one component of it for me. And to me, looking through my work through an equity, social justice. Oh, did I mute on accident?
Only for a moment, we can hear you now.
Oh, social justice framework, queer feminist frameworks guides me through this work. Thank you so much, Amelia, for typing in the chat, increasing awareness, increasing services available to people with hepatitis. Extremely important. Would anyone like to unmute and share? What is guiding you to this work? What guided you to viral hepatitis? Why hepatitis elimination? I'll give folks a second because I see responses rolling into the chat. Kaylin wrote, elimination will help bring all the work being done statewide together so elimination can be accomplished quicker and as a collective instead of in silos. Absolutely.
We also have Amelia's response: increase awareness, increase services available to people with hepatitis. Their passion is people who use drugs, started in syringe services, and to do more beyond diagnosis. It's so challenging to link people to services in Utah.
All right. I'll give folks another minute. I hope I will see more responses rolling into the chat. Again, just a reminder, this space is a learning collaborative. We're learning from each other and our experiences. So please feel free to chime in the chat as well as unmute so we can all learn from each other. So as I was preparing for this presentation, one of the things that has come up over the many times that we talk about hepatitis coalition building and hepatitis elimination is the challenges that we face. Sometimes people are like, oh, you know, Hep Free NYC and New York City, they're bigger jurisdictions, or Hep Free Hawaii or California are bigger jurisdictions and they have more established coalitions. And so sometimes there's a disconnect between some of the longer, more established coalitions and elimination planning that have more recently started, which is why it's really exciting that we get to present with Tara so we can have this conversation and back and forth to explore what are our similar challenges as well as where we can both be learning from each other. And as I was thinking through this presentation, the phrase small is good, small is all kept coming to my mind in terms of this presentation. And that is from the Emergent Strategy Core Principles by Adrienne Maree Brown. I read this book a couple of years ago, and it has really guided my coalition building experience and my community organizing. So I wanted to share with you as some guiding ideas in terms of how I view community organizing and some basic pieces that we can take away from it as like folks on a journey towards viral hepatitis elimination planning. So the first one, as I said, is small is good, small is all. The large is a reflection of the small, which I think actually someone hinted to in their reasoning for why viral hepatitis, not doing things in silos. Change is constant, be like water. There's always enough time for the right work. There's a conversation in the room that only these people at this moment can have. Find it. Never a lesson, never a failure, always a lesson. Trust the people. If you trust the people, they will become trustworthy. Move at the speed of trust. Focus on critical connections more than critical mass. Build the resilience by building relationships. Less prep, more presence. And what you pay attention to grows. So I also say this, and as you marinate and keep this in mind throughout the presentation, I'm also trusting y'all to give me feedback, trusting y'all to ask questions and think about how you want to move through this process, and hopefully all of us showing up here together. So a little basics on where I come from in New York City for the hepatitis B and C prevalence. We have 241,000 New Yorkers living with hepatitis B and 91,000 New Yorkers living with hepatitis C in New York City. Under the umbrella of Hep Free NYC, we have two community coalitions. The New York City Hep B Coalition was started later. It was started in 2009 by the Health Department and community stakeholders. The New York City Hep C Task Force was actually founded by community service providers working with affected communities in the South Bronx, which had high rates. They were noticing high rates of hepatitis C in their communities and decided to build a coalition. And the Health Department eventually was brought on and joined that coalition. We have Hep Free NYC committees and initiatives under the umbrella of Hep Free NYC as well. We have an advocacy committee, an awareness day planning committee, Coalition Against Hepatitis in People of African Origin, which has a national chapter, which is a nationally run initiative, and we have a local chapter, Communications Committee, Research, New York Hep Clinical Collaborative, South Asian Hepatitis Initiative, and we do some external coalition engagement, such as participating in the Virtual Learning Collaborative with NASTAD, but also there are many other national coalitions that we try to plug in and participate in. Some of our community engagement strategies that we use are meetings. We have general meetings, committee meetings, special events. We also have trainings. We have a website, hepfree.nyc, which I believe someone posted in the chat. We also have email. We use Salesforce and MailChimp, which is an email campaign management software. We have social media platforms, and we do project development, which is collaborative based on community needs and requests. And an example of that is resource development or the hepatitis elimination plan. One thing we decided to work on in collaboration with NASTAD in the last year was a hepatitis coalition building toolkit. So part of the toolkit is we've been receiving feedback, and we wanted to share the resources that we have in New York City. So these are some components of the toolkit that we've heard feedback that folks may be interested in, templates that they can use in their own meeting structure so you don't have to develop things from scratch. So these are just some of the components that we wanted to share with you that we're still in process of developing it. So feedback is critical. What do you want to see? What would be helpful for your viral hepatitis elimination planning? Let us know. So included in the toolkit so far, we have meeting planning checklists, agenda structures, task management, yearly planning calendar, including annual commemoration events calendar of hepatitis events, materials, listings, and order forms, how to track data and attendance, how are you sending emails and tracking, making sure that you're sending email invites and updates to the partners that you want to communicate with, social media accounts, which is a more final step, as well as online image content creation and editing. And this is a picture of our coalition in person, way back pre-COVID, but it's a really lovely photo to think of those times. We use the community engagement approach with our work at Hep3 NYC. So we build and maintain a collaborative network. We coordinate and disseminate community health program information, opportunities and resources, facilitate networking of stakeholders to identify and share resources, identify community needs and collaborate to develop strategies to meet those needs, and actively recruit and convene a wide variety of stakeholders. I listed some of the stakeholders, which is like hospitals, health centers, community-based organizations, addiction and harm reduction providers, advocates, etc. So we decided to break down, I decided to focus on hosting coalition meetings or hosting meetings for elimination planning. While this, we have all hosted meetings, that's an assumption, but we've all hosted some form of a meeting. We're on the journey of coalition building and elimination planning. And I wanted to ask this question of the group. It's something we actually ask ourselves every quarterly meeting that we have within our Hep3 NYC team. And some of these basics, you'd be surprised how often they get left out, how often things just slip through the cracks because you need to have a meeting for elimination planning. You need to set a certain amount of time to meet with certain community partners. So I wanted to break down the concepts of hosting a coalition meeting, which is something we would do with the toolkit, and something if, depending on NASTAD's capacity, if we would host workshops afterwards where we could play around with how can we move better through the toolkit, as well as like tease out some of the concepts and workshop them. So my first question to all of you is, when hosting your coalition meetings or your elimination planning meetings, do you have goals for each meeting? And if yes, are you addressing the purpose and goals for your meeting? So feel free to unmute or post in the chat. Do we have goals for each meeting? And if yes, are we addressing the purpose and goals for each meeting? Or are we experiencing challenges with coming up with goals for each meeting? Odetta, I think you raised your hand.
Yes, I just want to say good afternoon and Happy New Year to everyone. My name is Odetta Dotson. I work for the Maryland Department of Health, and I'm part of the Maryland Coalition. And what we do is there's called the steering committee. So we meet first before we do have our big meeting. We discuss the agenda, our goals, who's going to present. So we meet separately. And then once you get the agenda developed, then we'll pass it on to the bigger meeting, the people who attend the coalition meeting. So yes, we do meet separately to identify and make sure that we stay aligned with our agenda and our goals and objectives. So yes, we do meet early before we have the big meeting.
Great. Thank you for sharing. Tara in the chat wrote, yes, we do. Is there anyone else who would like to unmute and share or type in the chat?
Hi, Sarah, it's Melissa from Philly.
Hi.
How are you?
Good, how are you?
I've had the privilege to talk to you offline a number of times. And so, but taking some of your advice, actually, from the last time we met, we have focused on having meetings only when there is a call to action. So we won't have people convene unless we're asking them to do something. So write a letter to, your congressman, or we're talking about elimination planning now. So with our next meeting that's hopefully we'll have planned here soon, we will have a draft plan for people to look at, or pieces of a draft plan for comment. So that's been really helpful for us to be able to share those goals and have something to accomplish when we do sit down and meet. So thank you for that.
Great, glad to hear that feedback is helpful. I will also share from our own experience, and hopefully someone else will be ready to unmute. We do try to set a goal for each meeting of what is the theme of each meeting? What do we want folks to be taking away? And that helps to guide the meeting. For example, elimination planning. Is our goal to get feedback on the elimination plan? Is our goal to just share the elimination plan? And sometimes refining what our goals are, as simple as broad and as simple as sometimes elimination plan can be, it can be very important to say, well, what do we want with the elimination plan? Do we want to hear from specific people? And sometimes that can help guide how we incorporate the goal into the meeting. I think, see Isabel's raised hand.
Yeah, so I am part of a baby coalition here in Virginia, and I guess I don't know if I should be embarrassed or not, but it just kind of occurred to me like, oh, I should have a goal every time that I facilitate these meetings. And so for jurisdictions like ours, it's just starting out. What could be like a small goal that would make me feel as though we accomplished something if we don't have an elimination plan set yet and we're really in those early stages?
I will toss that question back to the group. What are y'all's recommendations for Isabel? A baby coalition. What could be a goal for like the first couple of meetings?
Hi, this is Rachel from San Francisco. One thing that we found with NHEP-CSF is if there's really nothing to talk about, sometimes we'll cancel a month's meeting. But sometimes we will just have a short meeting for kind of just check-ins and updates from people, just to keep the community partners connected. And especially during COVID, it's been really helpful.
And it sounds like the goal there is just keep people updated on what's going on. And maybe that means a shorter meeting. And folks are also posting in the chat that Bronwyn wrote, we're just starting to incorporate explicit goals. For example, in the next meeting, the goal is to leave the meeting with a set of agreed upon measures and reporting periods for each state to complete before January 28th. That's a big goal. But these are very important. Thank you all for responding. I'm going to move on to our next question. So this is a follow-up question to the previous one, but do you set up your agenda to meet those goals? I will provide another example. In New York City, one of our goals, I actually shared our strategies because those are our goals. So if our goal is resource sharing every meeting, sometimes we think we have to come up with a new fancy resource or like come up with a new team or a new project. We bring our hepatitis C and Hep B booklets to every meeting, every single meeting. Those booklets have been around for 10 years, but we make sure that if someone is new, that they will be able to leave with a Hep B booklet and a Hep C booklet. They will be able to have the basics on viral hepatitis at every meeting. So at every meeting, we meet our goal because every meeting we share our resource. Those are for returning participants, for example. But by naming that, we make sure to include that in every meeting. The resource can also look different. It can look like a presentation. It can look like a new community partner that's sharing a resource or something to that effect. So that's how we set up our agenda to meet those goals. And sometimes we actually just put it in the agenda and then we don't have to think about it and we've met our goal. So do you feel that you would be able to set up your agenda to meet those goals? Or what are the challenges with that? This is a little trickier of a question. So feel free to add input and keep in mind, these are questions that we're asking for the toolkit. And these are why we're including this type of thing in the toolkit, because we have these questions that are often not quite as easy as we think to answer. And it's okay to say no.
I do apologize. Can you repeat that question again? This is Odetta.
Do you set up your agenda to meet your coalition or meeting goals?
This is Odetta. I would say yes, but I want to go back to the young lady who said, if you don't mind, she had a baby coalition, correct?
Mm-hmm.
One of the things that, okay, because when I joined my coalition, because I was with Maryland Department of Health, as part of our grants to support the Maryland coalition team. So I came on late. They already had their agenda, already had their goal for the year. But one of the things that we kind of focus on to plan for our goals for 2022 is to see who is on the board, meaning that what assets can each board member bring to the coalition. So right now, those are on our coalition, more into advocacy. So that's what they kind of focus on, because they had a big group of people that was really good in advocacy. So we also looked at who's on the board, what can they bring to the table, what are they more passionate about, what experience do they have, and then we kind of built our new goals around the team that we already have, if that makes sense. So we have people in prevention, intervention, so many different tools and talents that our group has, but we identify some goals and then ask, okay, who has these skills to really be able to implement the goals or objectives for the following year? So we did look at that to see who's already on the board and what can they bring, what knowledge they have. I just wanted to share that. Thank you.
Thank you so much, Odetta. Thank you so much for sharing that. That's super key and super critical. How are you involving your community in setting up your agenda? I'm going to go on to the next question. Do you have something you want participants new and returning to take away from the meetings? So one of the things that I heard many folks say so far was, if we have an agenda item that we want feedback or we want them to review the plan, we also in New York City say that we're going to have a coalition meeting so they can review the plan so we can move on to the next step. But what do we want the participants new and returning to take away from the meeting? Do you have something that you're offering your community partners instead of, as I speak as a health department employee, we're like, okay, community, we would like this information. We would like this information by Friday or next week, but what are we giving back? What are the things that we're offering to our participants and community partners? And I would love to hear this, because this is also a struggle we have in New York City about what are we offering our community partners to take away from each meeting.
So I have a question actually for you, Sarah.
Mm-hmm.
So thinking about the release of the elimination plan, I'm going to assume that that's going to be like the feedback. That's a very tangible outcome that came out of this work together, right? So I'm going to assume that is and was going to continue to be highly motivating. I want to assume for participants.
I agree to some extent, but I think we also struggle with this question, and I see others are also saying in the chat that they struggle with this question because it is a bit challenging. But the plan is one step, but the plan for us took a year. So if someone was participating back last January and they were like, well, I didn't get anything, you want me to wait? And the health department didn't really know. Well, as speaking from New York City, we didn't really know when the plan was coming out. So we couldn't say, we promise by this date, you will get something from us. We couldn't promise that. So this is something for folks to think about. And this is also things we can workshop in the toolkit. I'm going to continue for time's sake, but I'm glad to see that some of us are struggling with it. And this is something for us to think about when we're thinking of recruitment, participation, folks participating in elimination planning. What are we giving to our community partners instead of just asking and taking?
Oh, hello.
Yes.
Oh, sorry, I know you wanted to move on, but I just want to say real briefly, this is Akia Groves from South Carolina. One of the things, and I think for me at least, this is one of our main points for me for having a coalition is for the networking and the sharing of resources. So we have a plan and we have some ideas of what strategies and activities we want to accomplish. But given that it's unfunded, we're not sure how successful we will be with that. But I know one thing that will be a success of this plan and this coalition is just being able to have a forum for like-minded individuals across the state working on hepatitis to meet each other, to know each other, know what we're working on, and just having that information exchange and possible resource exchange. I guess communication isn't the best across the state. We often hear people in the same county, in the same city, not knowing what others are doing. So I think that's a great success for, at least for me.
Thank you so much for sharing that. I want to pull out two things, or one thing that was mentioned in the chat. Kaylin wrote, ask the participants what they need and want from the health department. I was waiting for this because how often do we ask our community partners during meetings? Well, we asked you for feedback. Do you want the feedback tomorrow? Like, how can we provide back something to you to reflect that we appreciate your participation in our meetings and elimination planning as well? So that's key, asking participants what they need and want. I'm going to skip that one. I'm going to go to the last one for the sake of time, but do you evaluate your meetings? And if so, would you share how you evaluate your meetings? I'm going to give us like a minute or two to respond because we really want to hear from Tara, which is the next presenter. So if folks would share either in the chat, but feel free to unmute yourself. How are you evaluating your meetings?
Hi, this is Jess Hume from Arizona Department of Health Services. We just hit our 1 year mark with our coalition. So we did, thank you. So we sent out like a Google form to our members and people who had attended our meetings, kind of asking for feedback on how our meetings went, what more we could do, what had worked well, what they'd like to see in the future. And so that's how we did that.
That's a great idea.
I just dropped that survey in the chat if anyone wanted an idea of what that could look like if you're interested. I wrote that a couple weeks ago.
We're also going to snag that and possibly include some of those questions in the toolkit. We also have questions we ask in New York, but hopefully this way, baby coalitions won't have to figure out new questions. Someone else in the chat, Shamia, wrote, we use a lot of live surveys like Menti and follow-up message and created a networking platform to encourage continuous communication. If one other person wants to unmute before we move on and share. All right, so one of the things I will share about evaluating your meetings, think both quantitative and qualitative. So many of us have picked a side between quantitative and qualitative, which is fine, but we do need both. Simple things, I think some of the questions that Arizona shared out loud, I'm not sure if it's in the presentation, was how did you feel? Provide feedback about the meetings. Did it go well? Would you like anything different? We also asked those similar questions, but quantitative ways we can measure how our meetings went is how many people attended and did they come back the next time? And did they come back the time after that? So small, little, and so if you had 10 people at the first meeting, you have 10 people at the second meeting, and you have 10 people at the third meeting, and you have 9 people at the fourth meeting. Honestly, that's a great job because you've kept 10 people in the same room for 4 meetings. So that's a great way to evaluate the meetings. So think of it that way too. And this is things that we can workshop and dive deeply into when the toolkit comes out. So I want to go back to the emergent strategy core principles really quickly. Just a reminder that small is good and small is all, especially for smaller coalitions or medium coalitions. For example, our Hep B coalition on average has 30 people attending. And when we see that number go up to 40, we get really excited because the coalition's usually at 30 people. And also maybe 1 or 2 people may talk the whole time. And if 1 or 2 people talk, that's great. Change is constant. There's enough time for the right work. There's a conversation in the room that only these people can have at this moment. Find it. I will share one of our experiences about our South Asian Hepatitis Initiative, actually. Our South Asian Hepatitis Initiative was started about 2 years ago. It started with 4 of us at the health department who were of some degree of South Asian background. So it was 4 people. We were committed to trying to work on this. We had 1 provider. So I think of small as good as small as all. We thought we needed like a big team and the whole force of the coalition behind it. But we just chipped away. We started with developing 1 single material that was culturally competent. And we don't have many people attending our meetings. We're still trying to get people to attend our meetings. And it has sort of been this back and forth of like, is this worth it? Is this time worth it? How much effort should we put into it? And I want to share a story from our recent South Asian Hepatitis meeting where there was actually only 3 community partners that showed up to this meeting. And we were really disappointed because we put a lot of effort into promotion. We put all this time into it. It's been like 1.5 years. It was really frustrating to only have 3 people show up. One of the partners offered hepatitis B testing to 2 of the other partners in the room. So they said, we will show up at your events. And we were like, wow, that's amazing. These 2 other partners got free testing. And if it was probably a meeting with 30 people, maybe this person wouldn't have spoken up. And the 2 other people in the room were able to speak their language in the meeting and communicate and use terms of endearment. And we were like, if this was a big meeting, this could have never happened. And we had conversations about our materials that could have never happened in a bigger room. And so there was a conversation there that maybe we got frustrated that there was only 3 people at that meeting, but it turned out to be, we got resource sharing, access to testing, we got clinical provider referrals, we got feedback from our materials, and everyone left the meeting with something. And it fit in line with our goals, which none of us anticipated could have happened with just 3 people in the room. So if we leaned into that trust a little bit more, if we moved at the speed of the meeting, if we focused on the connections instead of wanting 30 people in the room, if we did all of the prep, but it was really us being present in that moment and asking some good questions since we only had 3 people there. And it felt like what we paid attention to grew. So that was our little baby 3-person meeting that went really well. And I wanted to share that with y'all because sometimes I think we lose sight of those small critical conversations that happen. And I'm actually so appreciative of everyone who chimed in today because I feel like I'm learning from all of y'all and I'm gonna get to see the Arizona feedback survey and think about how we can do things differently. And hopefully the toolkit will be a resource all of us can use and continue to workshop. I'm actually going to end my presentation, even though I have a little bit more, but I think that's okay. Is that okay, Isabel? Because I really want Tara to be able to present. Thank you all so much. And I hope you continue to give feedback and I hope you pitch in on the toolkit as well.
Are you ready for me to share?
So ready.
It's already.
So
okay.
ready.
Okay.
So excited.
Okay, what can you see? Can you see this?
We can see that.
Okay, good. Okay, first I want to thank you guys for having me here today. My name is Tara McKinney. I'm the Viral Hepatitis Director at the Missouri Department of Health and Senior Services. I've been in this role with the Viral Hepatitis Prevention Program for about 6 years, and then in my role as the actual director for about almost 2. So not a long time as the director, but have been in the viral hepatitis world for quite some time now. So the objectives for my presentation are to give you a background of our program, some of the things that we've done to build our committee that we are using for our elimination plan, and then tools for engagement and ownership, and then what's next. So in order to understand some of the barriers and challenges that we've had throughout our process, it's good to know the background of our program. First of all, the Missouri Viral Hepatitis Program has 2 staff, myself and one other, and we are situated in the Missouri Department of Health and Senior Services, the Bureau of HIV, STD, and Hepatitis, which that's really great because we have a lot of colleagues and coworkers that are cheerleaders, and we can leverage support and funding from them. So that's a great thing. Missouri is very, very diverse in that we have a lot of rural areas, and then we have some major population areas. So we have St. Louis, Kansas City, Springfield, but then the rest of the state, and then I'm in Jefferson City, which is not really urban, but it's a larger city. And then we have a lot of really rural areas. So we have to take those things into consideration whenever we're doing any type of planning for hepatitis or anything really. So our mission in the Viral Hepatitis Prevention Program is to reduce the burden of viral hepatitis among Missouri citizens by being a resource for education and awareness, testing, and linkage to care. Our main focus is hepatitis C. Hepatitis A and B are located in other offices within the department. So we're able to focus on that. Hepatitis A is in immunization, and then perinatal hepatitis B is in special healthcare needs. So in 2018, the Viral Hepatitis Prevention Program created the Missouri Viral Hepatitis Stakeholder Work Group. Prior to that, we had a work group called CPPG, which was the HIV Comprehensive Prevention Planning Work Group, and we had a subcommittee within the HIV. At that time, I was like, I wasn't getting a lot out of that group because their main focus was HIV, and they weren't at that time really ready to come over to the hepatitis side. I mean, they do a little bit, but it just didn't have the momentum. So we wanted to form a group that maybe they didn't focus on HIV, but they did some HIV, some hepatitis, and really had a passion for hepatitis. And this work group really did represent that. So really proud of our viral hepatitis stakeholder work group. The program provides prevention education and awareness, rapid antibody test kits, and collaboration with stakeholders. So here are our barriers. Until 2022, we did not have any specific funding for viral hepatitis surveillance. We have no state funding that we receive for viral hepatitis, no set-aside funding for hepatitis C state laboratory testing. So we actually do not have any hepatitis C state laboratory testing available. Missouri has laws that prohibit syringe service programs, so don't have those. The COVID-19 pandemic, of course, everybody is aware of that. And then just until recently, we did not have expanded Medicaid. So when we started this process, that was not happening. They finally voted it in, but even when they voted it in, there was a lawsuit saying that it wasn't, I don't know the whole deal, but it was a whole deal. And it took a while for it to actually come into effect, but it is into effect now. So that has been a blessing. So pre-work. I remember sitting in the hepatitis, viral hepatitis conference, NASTAD conference in 2019. And I specifically remember Isabel because I loved her glasses. She's so cute. And I remember sitting there and her going around the room and saying, can you tell me where you are with your elimination plan? And my heart just like sank. I'm like, oh no, we haven't even talked about it. What am I going to say when it's my turn? Anyway, I sat there and I heard a lot of states say that they hadn't started, so I started to feel better. Anyway, after that meeting, I talked to my bureau chief at the time, and she was really on board, and thank goodness, because she's like, we need to get ahead of this. We're gonna, let's start working. Well, then COVID happened, and that kind of pushed everything back. But when we picked it back up again, we're like, oh, we need help, because I had been through several webinars, things like that related to elimination planning. But when I would talk to my stakeholders about it, it was like, they felt kind of the way I did when I was sitting in the NASTAD meeting, like, what? Like, we don't have anything. How are we going to do this? Very overwhelmed. So I contacted HepTAC for assistance, and they set it up so that in the first quarter of 2021, before we even received the grant that was going to be focused on elimination planning, to have webinars for my stakeholder work group with Louisiana, Hawaii, Pennsylvania. This was huge. It sounds so simple, but it really was huge, because what I learned and what our stakeholders learned is that other states don't have everything either. We're not the only ones that that are struggling and have a lot of barriers. Other states do too, and they're still able to write a good plan, and we can do it too. And really, it as a program coordinator gave me the courage, if that's the right word, to tackle this, because I was really, really overwhelmed with it at the time. So from there, we decided that we already had that Missouri Viral Hepatitis Stakeholder Work Group solidified. Let's create a survey and see who wants to be on the Hepatitis C Elimination Planning Committee. So we sent out a survey to them and asked for their demographics, what area of expertise they have in hepatitis C. And this was really important because it comes in really handy later. Would they like to participate in the planning committee? Because we knew we were going to have a very aggressive timeline, and we really wanted people that could commit to the work group. So do you have the time to participate? And if you don't, do you know somebody that does, or can you delegate someone else that can? So we put that out there, and we got great responses. And some of the partners that are now in our MoHepC group, which is a really funny story, because the MoHepC acronym came about by accident. It's literally Missouri Hepatitis Elimination Planning Committee, just so happens to be MoHepC. So that was really cool. And anyway, but we have partners in our work group, or our planning group, MoHepC, federally qualified health centers, local public health agencies, community-based organizations. I won't read the whole list there, but making sure that when we did the survey, we saw gaps and who were not identified. And so then we did try to reach out, talk to some other stakeholders, like who could we reach out to be on our group, so that we made sure that we had representation from all different organizations. So we had our first meeting August of 2021, and it was an aggressive agenda, to say the least. And we did a lot of pre-work. It wasn't like we just were like, okay, come up with a timeline, come up with a mission and vision, come up with the SWOT analysis. So we established the timeline, made sure everybody agreed on it, created a mission and vision, but let them provide input on it. And they did change it. It wasn't like they just agreed with what we had already put down. And then we completed the SWOT analysis a little bit, but they were able to add, and they changed things on that too. And then we asked for input on branding or slogans. So we wanted it to be fun. We had like 25 submissions for different ideas. And then we had we eliminated it down to 5. and had our bureau vote on the actual name, and it is Show Me the Cure. So here's our timeline. And as you can see, August isn't on here. That was our first meeting, but we plan to have it done by May. And I'll go on a little bit more about what we have done so far and show you some of those slides. But it was very aggressive. And again, I really think our leadership for that, my direct bureau chief has been really supportive of this and is like really encouraging us to move the needle forward. So it's nice to have that extra nudge of support behind you to keep the momentum going. Here's our mission and vision for MoHepC: to create a plan to eliminate hepatitis C in Missouri by increasing access to universal testing, improving healthcare outcomes to people living with hepatitis C, and preventing new infection while increasing dignity and reducing stigma. It's a long one. And our vision is by 2026, increase access to and capacity for hepatitis C prevention, testing, and treatment for all Missouri citizens. And the key word is there is all, because right now it's not that way. And so here's our SWOT analysis. And if you're not familiar with that, it's basically identifying your strengths, weaknesses, opportunities, and threats, both those that are helpful and harmful. And so we had lots of strengths and lots of opportunities. And this was really nice because we tend to, in Missouri, focus on our weaknesses and threats because we feel like we don't have a lot, and that's really hard. So it was really nice to like actually start writing things down and be like, here's what we have, what we do have. And so this is what they came up with. And from that, we developed 4 pillars of focus, and they are access to services, policy and advocacy, education, collaboration and awareness, and surveillance. From these 4 pillars, we divided them out into subgroups, and that's where we went back and used that survey that we did in the beginning, and we're like, oh yeah, they belong here, they belong here. Now we did have some of them move around, and we let them do that. But for the most part, that survey served as good fits for putting them in their subcommittees. And then we also nominated co-chairs for each one of those subcommittees. So in between our first meeting, well, I think it was our second meeting, those subcommittees met, and we assigned them to come up with goals and objectives. And we were going to wait and do methods of measure and activities later, but they were on top of it, man. Some of those groups were just like, we're not going to wait, we're just going to do it, which was awesome. So in November, we did meet in person. And this allowed the committee to assist each other in rewarding, updating, and finalizing each, or rewording, I should say, and finalizing each pillar of their focus. And so each group was able to kind of like give a presentation on their pillar and really get input from the rest of the committee members. So tools for engagement and ownership. And this is really, really important. I highly recommend that you get a facilitator. We got a facilitator for our work group. It kind of gives me the opportunity and my staff the opportunity to actually participate instead of having to be like, leading the meeting and all of that good stuff. And making it their plan. This group has really, like, if you give it to them, they were like hungry for this. They were ready to do it. And I think they like that they have so much input related to it. And I think someone said it earlier, is like giving them a space. We are giving that back to them because they don't have a space really that's just a focus on hepatitis C. It's usually connected or leveraging something else, or attending a meeting that's about substance use disorder, but being the hepatitis person at the table, where here you're with all your people that also want to talk about hepatitis C too. So I think there was a lot of energy there. Being consistent on meetings and timelines, like our timeline is our timeline. We're having a meeting Now, we did cancel one, like I think in December, because there wasn't anything to talk about and there's no use to hold a meeting. But don't let a lot of time go by without communication, because people they kind of forget about it. They have other jobs, they have other things to do, and it kind of loses interest. And sometimes urgency is better. Like if we would drag this out, it would lose the momentum. But it's like there's an urgency to it and we've got to do it and we've got to get it done. And then give them responsibility and freedom. Like I said, I gave subgroup chairs to them, to each subgroup. I didn't attend every subgroup meeting because we are the state Department of Health. And sometimes you want to be able to talk about the state Department of Health, you know, and have that freedom and that open discussion about what may be lacking at the state level without feeling like they're going to hurt feelings. And then gratitude, of course, gratitude, praise, praise, praise. And some things to be ready for, doing a lot of the work, being patient, and lots of reminders. Like, it wasn't like we gave them an assignment and it was like they turned it in right away. Like, you know, there was a lot of legwork. There was a lot of, hey, do you have your SWOT done, or do you have your pillar done? Lots of reminders, and be aware of silos. And this is really important, and members' organizational agenda. Sometimes we could really get off track with, you know, some members, they are rooting for their organization just like everybody else is, but they could really get things off focus. Like they had an agenda for their particular organization, and you couldn't shake it, and it'd be like, hey, we have to get back to, we're talking about all of Missouri, you know, not just this city, not just this county, not just, you know, we're talking about Missouri as a whole. And one thing I didn't put on the slide, but that is really important, is that just because it can't be done doesn't mean it shouldn't be in the plan, because they got really caught up with that. Like, there's no way we can do this. Well, if we don't ever get it on paper, then we're never probably going to do it. So, and it doesn't mean that you have to do it. And it doesn't mean that the state may be the one to do it. It may be somebody completely different that's not even at this table. But let's at least put it in there, because what needs to be in here is what is going to eliminate hepatitis C in Missouri, not what we can necessarily do. Because if we don't write it down, then nobody's ever going to know how we're going to eliminate hepatitis C. That's how I felt about it. Like, other people that are reading it, who are we writing it for? We're not writing it for people that already know about hepatitis C and what is needed. So if we don't put it in there, then they'll never know, which was really hard to do. And this is our work group from our in-person meeting. And we have actually more people than this. There were some of them that could not attend, but we are not a large group. Like I think Sarah said, there were 30 at the hepatitis B work group. That's about all we have in our hepatitis C work group. But we are strong and mighty. And I love what she said, small. I forget what the exact quote is, but small is not necessarily a bad thing. So, and what's next? So we have planned a coordinated launch. We've already started talking to our Office of Public Information about doing press releases, a social media campaign, web pages, presenting at meetings, conferences, exhibits, anywhere we can, share with various stakeholders and encourage others to do so. And then just keep this momentum going, because I was thinking the other day, like, once the plan is done, what now? Now we got to work on it. So we've got to keep this energy going and make sure it doesn't just get dust on a shelf and be like, oh, check that off the CDC grant list. Now what? You know, like we need to like work on the plan. So, and that is all from me. And I know we probably have like 1 minute for questions, but.
Thank you so much. I didn't go into this VLC thinking so selfishly about my coalition work, but I just took notes upon notes upon notes, and I'm feeling actually really inspired and overwhelmed at the same time, but still I have some action items that I think I can take back. Yeah, and it's been just such a pleasure to watch y'all just launch, and also Sarah, and want to make a plug for their elimination plan that was released in December. Yay! That being said, any questions, feel free to email me. I think this is one worth following up on. I think I'm going to invite y'all back. I have a feeling there are a lot of more intimate opportunities for TA. Now, Tara, you're going to be on the other end. People are going to be asking you for TA. So, I hope you're prepared.
Well, and I was going to say that at the end too. If you have any questions about anything that I talked about today, you know, being in a Missouri in a rural area, it's when you go to conferences and stuff, like you start to compare yourself to other states, and it's like it's so hard to be like, how can I make that happen where I am? And it gets really overwhelming. So if you're one of those states that are kind of in the same boat as Missouri, you know, I would love to hook up with you, because we could share ideas for sure. So
awesome. Yay, thank you. All right, we are right at time. So I'm going to stop the recording, but